So the 21st of May, the DSA going forward on the 21st of May. And we'll be looking at DSA Engage, our work with government and local authority services, a little bit about information, training and support and research, our voice, an update about our new website, and one of them, the little excerpts to advertise a podcast, and then questions. Thank you very much, and over to Sharon.
Hi, good morning, everybody. I'm always happy to talk about DS Engage. It's been a fantastic project getting us all off our settees and off our chairs and doing lots of exciting and interesting things, like things I've never tried before, yoga and dance and workouts and cooking and crafts and all sorts of activities. I've been to more discos, honestly, in about the last 6 months than I've been to in the last 20 years, maybe even 30 years. So it's been great. I feel like such a young person all over again. And I love doing it with everybody. So we have a completely blended program. You can watch pre-recorded activities, as it says here, or you can do live things on Zoom, and then you get to join in with other people at the same time. And another benefit which we've been hearing of is that it is definitely contributing to people's well-being and helping people's mood improve, as well as keeping physically fit and healthy, which is true. Honestly, I don't think you can join in with Mr. Motivator or a disco or a dance session for more than about 3 minutes and your mood improves straight away to see everybody on the screen and moving, listen to the banter, and you join in and you feel better. So if you haven't tried it yet, which would be hard to believe there's still people who haven't, but if you haven't, do join in something and you absolutely will not be disappointed. I can guarantee that. And one of the other things I love about DSengage is people are very responsive and good at feeding back, letting us know how they're getting on. So the next slide just shows a quote we had very recently, which is lovely, from Sam's mum. And she said, DSengage has been a lifesaver for Sam during the lockdown. For people who live alone in supported living, these sessions were his only social contact. So, of course, we're delighted to hear that DSengage has been good and it has been providing a great social contact for a lot of people. So don't miss out. If you are missing social contact with other people, you can connect with people in DSengage, which is great. And then I just have some pictures to show you from this afternoon session. We always have Pilates on a Friday afternoon, which has been really enjoyed. I think Pilates has been new for some people, but everyone is welcome to enjoy it. Family members, parents, people who have Down syndrome. This is just a little glimpse of people stretching out. So it's a nice way to stretch, relax on Friday, and then feel ready for the weekend. You can still join in that this afternoon at 4 p.m. or any other Friday for that matter. And then the next slide also just shows you a little glimpse from our survey. So thank you so much to everyone who responded. So we mentioned it at last Friday's update, and then we had a huge number of responses in the week. I would love to show you all the results, but the really good thing to hear was that overall people have enjoyed all the sessions that we've run. There wasn't any session that lots of people said they didn't like. People actually enjoyed everything. And you'll see from this little bar chart, when we asked the question, what events would people like to attend in future? Well, pretty much everything that we have already been running, people are happy with and want to continue attending, which was great to hear. So we know that people are enjoying what's running. And we had lots and lots of really nice quotes and really nice feedback that has been very, very helpful. So this was just one little snippet, a quote saying, David is totally enjoying the events and is improving well-being. So thank you to everyone who organizes. But I was particularly happy to hear about the well-being part, because the physical fitness is not in doubt, because if you're up and moving 5 times a week, at least through DSengage, you must be moving a lot and getting fitter. But well-being, that's really nice to hear that people's well-being is also improving. So thank you, everyone. We will be going through all the survey results and suggestions, and you'll be pleased to hear the popular requests for Zumba and karaoke have been taken on board, and we're hoping to bring that to you soon as well. So new ideas still to come. The next slide just reminds you about the timetable. So that's on our website. You can print it out. Don't miss anything. There's a full weekly program of pre-recorded and live events, and they're all listed on that timetable. So you can sign up, join in with all of them. Don't just choose a few, just get stuck into everything. And then, as always, my suggestion for this weekend on the next slide. So this weekend could be a bit showery at times. So if you're dodging a shower, go to the YouTube channel, and we have Fiona demonstrating and talking you through making a very delicious club sandwich. So get out when it's dry, come in when it's raining, follow along with Fiona, and you'll have a lovely club sandwich to eat as your snack in the weekend. And then finally, let's get to the specials. So next week, I can't wait for this. On Tuesday, next Tuesday at 4 p.m. is our talent show, the first ever DS Engage talent show. So many people want to take part that there's a really wide range of people performing, singing, dancing, all sorts of different things. So you may not be able to perform this time, but please come along and support the performers and smile at them and cheer them and clap them. That will be great. And it will be lots of fun. Absolutely. And then 2 weeks after that, on the Tuesday afternoon, we have Singing Hands. So we've had Singing Hands once before. It was a really, really good session. It's for all ages. So literally, if you're a child, right through to any age, it doesn't matter. You'll find some piece of music you enjoy, Macathon you can join in with, and it's a great afternoon event. So put those in your diary and sign up. And I can't wait to see you there. Thank you very much.
Thank you very much, Sharon. And now Julian.
Good morning, everybody. Really good to connect with you all again. Such a lot's happening as each week goes by. It's always difficult to select really which to choose to focus on. So these are just a couple of headline slides to tell you some of the work that we're doing with government and other policy makers. Some of you may have seen that we've been quite closely involved with research that's going on. It's UK research, but we particularly connected with the lead researcher at the University of South Wales, Professor Stuart Todd, who was looking at how COVID-19 had affected people with a learning disability. Obviously, we know all of us have been affected over the last 15 months or so, but he particularly wanted to see what the impact was on individuals who have a learning disability, and sort of connected with that. One of the key findings from the early part of the research, so it's still ongoing, they've published the first part of the findings, is the impact that the way GPs were working had affected how likely individuals who have a learning disability were to get an annual health check. So Welsh Government have taken this on board and are now looking at ways that they can improve the rollout of annual health checks and finding out whether there are some improvements that can be made, particularly around whether some of that might be able to be delivered online, then perhaps with a follow-up visit actually in the surgery. So we're going to be engaging with Welsh Government over the next couple of weeks and months on that piece of work. And then I think going on to the next slide, we mentioned this at one of our updates a few weeks ago, and we're now progressing forward with the work that we're doing with teams of filmmakers and researchers working with NHS in England. They want to produce some really nice films for pregnant women and prospective parents, and they want to engage with us to make sure that the information about Down syndrome is really good and accurate and up to date. And we've already identified quite a number of very new parents, but the next stage of our work is wanting to engage with just a few. It's quite a small focus group, but we would like to put the call out to families of children aged around about 3, and then a slightly older child, so primary school age child, who would be willing to take part in a focus group and potentially perhaps have a little bit of their story filmed. So the contact for that is Jill, and her email address is there. So if you fit the bill or you know of other families that might be interested in taking part in that, do get in touch with us, as that's something that we're going to be doing in the next couple of weeks. And then moving on from, some of you may have taken part in our Tell It Right webinar that we held about a month or so ago. Some of our parent members who are connected with the support group that covers Jersey came to that webinar and are really interested in the work that we're doing around training antenatal and maternity professionals, and are keen to meet with us and discuss how we can try to roll that out on the island of Jersey. So we're going to be connecting with them virtually next week, and are looking forward to see how we can take that forward. And then I think I'm going to hand over to my colleague Chris in our info team.
Yes, and just a quick point, thank you, Julian. Just a quick point to note that as the slide states, we've been working with parents and the local authority to improve support for learners who have Down syndrome in the area. So hopefully we'll be able to share more about that in sort of the coming months. It's with a view to developing a pathway for young people who have Down syndrome. And there's some really fantastic ideas coming out of the working group. So yeah, we look forward to contributing to that. And alongside that, we've also been working with the Department for Work and Pensions, or the DWP, to improve the experience of claiming employment and support allowance for people who have Down syndrome and their families. So yeah, two great bits of work that we are currently involved in.
Thanks, Chris. And then moving on to, you may have seen some of the posts that we've made on social media about trying to gauge the experience that families have had, partly to do with COVID-19, you know, cuts to service provision, but this is a general theme that, you know, we regularly speak to people on our helpline, and our information officers very often help families navigate the system around local authority service provision, and if charges are being made, whether that's fair and accurate, and supporting people if they feel that they want to challenge that. So we're looking at representing the experience of families over the last year or so, and have been sort of collating case studies, and have had quite a number of families contact us in response to that. So there'll be more, I'm sure, that we'll be sharing on this area of work in the coming weeks. And then I think this is the final slide from me. Learning Disability Awareness Week is always towards the end of June. And to coincide with that, we're working with partners at BUILD, British Institute for Learning Disabilities, and other lead researchers, people that we work with regularly. Many of our families may have taken part in some of the research that's going on in the UK around ageing, and there's going to be a conference it runs over 3 days, the 22nd to the 24th of June, and Carol and various other DSA staff will be contributing to that. So that's something coming up in the next month.
Thank you, Julian and Chris. I've listed the support activities and training activities that are happening now and over the next month, including Wellbeing Wednesday, the pregnancy and baby support meetings, sharing positive support, case studies where a small group of people delve deeply to discuss and explore solutions that some of them have had. Okay, and the WorkFit training event is on the 3rd of June. Restore to Mini is now up on the website for booking, and that's on the 30th of June. That's about health, and it's for parent carers. Early years in primary education, supporting early development from birth to 4 years, preparing for adulthood, 2 sessions, because there's a lot to cover there, and that's now available for booking onto a new session which we haven't yet made available for booking, but will be on the 6th of July, and it'll be a long one, a 3-hour session, but it'll be very good. Tell It Right is ongoing every day, and then plans for an education webinar and a mathematics webinar. And now I'd like to ask Stuart to say a little bit about our support for research.
Thanks ever so much, Jill. We're always very happy to support postgraduate research sort of studies that we feel might be of benefit to people who have Down syndrome and their families. And we have a process whereby we ask researchers to complete a research proposal form and send that to us with ethics approval. And we've been really pleased over the sort of past couple of weeks that we've had a sort of influx of researchers who are looking for support with their studies. The support we provide is primarily around advertising studies via social media and our website to encourage recruitment. And I'll give you just a couple of examples of studies that we've recently supported and advertised via sort of social media. So one is speech traits that are common in people who have Down syndrome, and that's being carried out by a researcher at Wayne State University. And she's asking for the submission of videos of people who have Down syndrome speaking, and this is open to anyone who speaks English and people who are able to speak in sentences. And she's hoping that the information she gathers will help her to develop strategies to address the issues that she identifies. And another is a study that we're supporting from Aston University, which is looking at eye care in people who have Down syndrome. This is adults, and looking at the impact of COVID on eye care for adults. And there's an accessible survey for adults to fill out that we've been promoting via social media. Thank you, Jill.
Thank you. Right, over to our voice for Robin to introduce Daniel.
Thank you very much, Jill. So yeah, I'm just going to talk a couple of slides and then Daniel will be coming to say hello. So our voice is part of the DSA team and we work together for change. If we go to the next slide. For the past 4 weeks, we've all been working on this cycle. We've talked about what the DSA does. We've talked about working together and co-production, having your say and self-advocacy, and then we spent a week planning some work together. So we've done all of those 4 things. We're now in this arrow at the bottom. We are currently looking at the plan and we're going to release that as a report that will be easy for people to read, and people can contribute to that plan more if they want. And that is going to change what the DSA does and some of our activities and the way that people with Down syndrome are involved. So we're in this very exciting arrow at the moment, and some of the group members will come to one of these updates soon to tell you about that plan and how we're going to start some of the projects. I am now going to hand over to Daniel, who is going to just unmute yourself. There we go. You're up, Daniel.
Okay. Action. Our voice has portrait mappers. We would like you to team some for team. Do you to school? Tessa. Madam washing a pad and portrait team mapper. Eddie a great Africa. Okay. Catherine for time good working and Pat. Chris chef. Right. Color good except I'm a happy person. Jack, Epic, SKIE, Whiskey. James, Tesco, Sun Master. Sarah, Notes, for Roast Castle, Jimmy, Kurt, Waking, and Great Team Mapper. Nothing, man. Joe, Nutter, and Ritter. Marin, Roots, and a model. Nosy, DSA, sports person.
Wow. Thank you, Daniel. That was awesome. Well done. Thank you.
Daniel.
Fantastic job. Okay, I think there's some more photographs now to show. Sean, gardener, chef and hiker. Isla, inclusion expert. Sam, online cooking teacher. Alex, our voice interviewer. And Brogan, I be a TikToker. Thanks very much.
Thank you very much, Daniel and Kate and Jane and Robin. And now to Kate. Or
Sorry,
Sharon.
it's me
Sharon.
from the beginning.
It's
Yeah.
Sharon.
I have another nice and new and exciting thing to share with you. Our new website. We're very, very, very near to launching our new website, brand new. It will be live and launched on the 7th of June. So I hope you will start to get excited too. This is just a little glimpse for you of how the homepage looks on the new site. And I hope you will feel that it's exciting, clear, simple to use, simple to read, attractive, and most of all, enticing, that when you get to the homepage, it's so attractive and interesting that you want to click further and find out more. So the new website is absolutely full of information that will be useful to you, hopefully, and your families, and also lots and lots of different stories about people who have Down syndrome and their families, and lots of things about them. So to get to this point, we have been working with a smallish group of people, some stakeholders, people who have Down syndrome, and some parents and families, and we've had lots of input from them. When we actually launch, that's just like the first step of us going to a much wider group and going public. But we would love you to join in with us and help us make it even better. So when we launch, that's just the beginning of getting to the final product that we want. So please do, as soon as you can, jump into the website, have a look around, and let us know what you think and what you feel, and if there's anything we can improve. And then together, we'll keep moving forward until we get the website that we all want, that will help us all for the future. Kate.
For moving in the middle of that, but there's scaffolding going up next door to that and I just thought the noise might be troublesome, so I popped into my kitchen. So as Sharon said, the website is still jam-packed with all the content that we have created over the years to help everyone and to inform them and help make, get to our achieve our goals. But what we have done is try to make it a lot easier to find all this amazing information. So if you see in the top picture there's a much simpler menu. So if you click on Down syndrome, you'll see that everything is much more easy to find straight from that very first page. So we've split the information about Down syndrome into 4 sections, and each of those pages has links to all the information that you'll need on that. You can click one click away and it'll be there for you. On the next slide, you'll also see that the website will work much better in different format on different devices. So the top picture there is what it looks like on a PC or laptop, but then it will also work just as well on a tablet or a mobile phone. So obviously this is really important because, you know, we all want to find things when, you know, we might want to find things when we're sat on the sofa with our tablet, as well as when we're sat at our desk on our laptop. So we really wanted to make this as accessible as possible. And I just, like to follow up on what Sharon said. We're really keen to get your feedback, and we'll be putting a survey together so you can let us know what you think really easily and quickly, and we hope you'll be pleased, and it's going to be great. Thank you. That's me. Oh, I'm carrying on, aren't I? Sorry. Yes, I just wanted to share this lovely thing that happened on our LinkedIn page, and I'd just like to commend it to you if you're on LinkedIn yourself. We would really value your support on LinkedIn, because the networks that people have on LinkedIn are always slightly different, and you'll reach certain people, different people than you might on your Facebook or your Twitter accounts. And it's a really great way to help us spread our messages. Last week, Alison talked about some of the people starting new jobs, and we shared this great picture of Marcus getting his offer on our LinkedIn page, and it's got some amazing coverage and reach, as you'll see in the image at the top there. And we were chuffed that Marcus's dad shared this lovely comment about how important it is for everyone to sort of engage with the idea behind WorkFit and to help make it happen. I think that's my last slide, Jill.
Thank you. Well,
yes.
Yeah.
So this is Alan, and he is one of our wonderful 50 years podcast oral history participants, and he's an amazing character. He lives with his mum and cares for her, and he's a regular at Leap One in Leeds, like Susan, who we heard last week. And he's also a steward at the People's Parliament, and is very passionate about advocacy for people who have Down syndrome. This is a little taster of his oral history, and I would commend you to go to the website and listen to the whole thing. But in this little clip, he's talking about his girlfriend, Colleen.
Can you tell me a little bit more about Colleen?
She's nice, kind, respect. I love her so much.
And where did you meet Colleen?
Here at Leap.
Do you think you'd like to get married?
In future. I'm not rushing her.
Thank you, Alan. Thanks, Kate. And we'll now take questions. People have been putting some questions into the Q&A box. And somebody's commented that there's no chat box at this time, which is true. There is no. We've taken questions in the Q&A box. And anybody interested in arranging Tell It Right, a mixture of online, but with your own speakers, or any type of Tell It Right package, please, get in touch with us and keep in touch with us, and we'll work out a way to do that with you. And then there's a question about an education pathway. Might that be something that other authorities could copy, working with local parents? Yes, definitely. Yeah, so we'll keep you posted about that. That's all for questions today. So I'd like to hand over to Carol.
Hi, everybody. Thank you for joining us this morning. I'm sure you'll agree this is a great way for you to find out more about what the Down Syndrome Association is doing for people with Down syndrome and their families. And this is just a fraction of what we're actually doing. There's so much work going on right across the organisation. So please share the recordings. We know that people are sharing them on social media, and that's great. So we're getting to a much wider audience with our updates. But do keep joining us as well, because it's great to have interaction, people asking questions, and that we can keep up with what's happening out there. Please don't hesitate to call us at the Down Syndrome Association if you have an issue of concern, or maybe you just want to find out more about what's happening. We're always happy to hear from people, whatever their issues are about Down syndrome. And the numbers, the email address is there on the slide. Please don't hesitate to contact the information team or call our helpline. And we do hope that you will join us again next week on the 28th at 10:30. Look forward to seeing you all then. Bye-bye, everyone. Thank you.